All right, Dr. Ben Latto O'Brien, Doctor of Chinese Medicine and Nutrition, and I am going to talk a little bit about disc problems. I've had a couple of new patients in this week with disc issues, and it's never explained particularly well what that means, and patients don't really know what's going on with the disc. And if they bring in their MRI or their CT scan or whatever, and we know they have a disc problem, or even if they test positive to a straight leg raise test, well then I know there's a disc issue. So this is just a quick little video on explaining what that actually means, because most people really don't know, and Western doctors unfortunately don't have time to explain that stuff, or whatever. So anyway, this is a video about what that means. So discs don't slip, they herniate. First thing, understand that. There's no such thing as a slipped disc. You have a herniated disc or a bulging disc. Discs don't slip, they bulge or they herniate. Let's have a look at what that actually means. Let me give you a little image of my skeleton. Now, you can't see that, so I'm going to lift it up to show you exactly what I mean. Here you have the intervertebral discs in between the vertebra. And there you've got the yellow, the peripheral nerves that come out of the central nervous system or the spine. Now, down here you can see redness. You can see a red disc herniation or a bulge, and you can also see that it's touching or impinging on that peripheral nerve. So what that will mean is that if that happens in someone's back, they'll get symptoms that go down their leg, into their glute, into the foot, into the lower leg, into the thigh, whatever. Nerve symptoms are things like tingling, numbness, pins and needles, burning sensation, some sort of altered sensation or weird feeling. That tells the practitioner that there is nerve entrapment. If you have a disc that herniates out the back and it's not touching the nerve, then you have no nerve symptoms. So nerve symptoms always mean something is impinging on that nerve. It's usually a disc, but it can be stenosis, it can be calcium building up and causing a thorn-like projection. So there's different reasons why, but this really, discs are a very common reason as to why you see the problem in clinic. Now let me show you another little model to make it even clearer, hopefully. So here you see the vertebra, you see the intervertebral discs, and you see the yellowness, which is the nervous system. So a normal disc is supposed to sit in between the vertebra, the bones of the spine, like this. This doesn't have a pin in, so I'm going to hold it in. But you can see, if I hold it up and I turn it, there's no impingement. It's not touching the nerve anywhere. So that's going to be good because that's normal. Now, if I turn this to the side, you can see there's a disc in there that's representing herniation and touching the nerve. It's what that red bulge is. And this is another image of what a disc looks like that has a mild herniation. So you can see the inside of the disc is called the nucleus pulposus, and that is bulging out through the tough outer membranous layer of the disc. It's called the annulus fibrosus. So that's obviously never meant to happen, and there can be different reasons as to why that happened. It can be stress, it can be diet, it can be physical exertion, guys at the gym or girls at the gym doing big weights, and or people in the garden lifting heavy pots. I hear that quite often, and then they feel their back go is what they say, and then they have symptoms, and usually lots of them, unfortunately. It's very painful, and it's not a particularly nice condition to have, a disc problem. There is things that you can do about it. If it's really bad, then yes, you have to go and have your back operated on, but that's pretty severe, and that's pretty far down the track. So there's quite a lot that you can do about that clinically before you think about going and having your back operated on. Cortisone injections are useful for some people. Some people get no response at all, or you can have anything in between. They either work brilliantly, not at all, or anything in between. So it's kind of a bit hit and miss. If it works, then brilliant. That sorts the problem out. If it doesn't work, well, then you're in trouble. So that's usually when people come and see me when they've had a few shots of cortisone and they haven't got any result. They don't really want to have surgery. So what are you going to do about it? Well, there are things you can do, and I'm going to do another video on that later. But hopefully that makes it a bit clearer what happens with disc pathology. So discs herniate or bulge, they don't slip. And if they touch the nerve, then you have nerve symptoms. Burning, tingling, numbness, pins and needles, altered sensation, funny sensation. The further down the leg the symptoms go, by the way, is also indicative of how much trouble you're in. So having symptoms going all the way to the foot is not a real good sign. When the pressure comes off the disc, excuse me, off the nerve, and then your symptoms start to improve, you see that the pain or the neuropathy, the nerve symptoms come back up the leg, and then hopefully they're just in the glute, and then they're in the lower back, and then they go. So you know that if your symptoms are quite far down the leg or going to the foot, you've got a bit of work to do. So that is Dr. Ben Latto O'Brien from Doctor of Chinese Medicine and Nutrition from the Natural Medicine and Nutrition Clinic in Subiaco. If you've got any comments or questions, if you like this video, if you're suffering with this and you want some help with it, you want to investigate that, well, give me a call at the clinic. The number will be around. Send me a message, send me an email, or give me a buzz, because I treat a lot of this stuff, and the things that I do generally work pretty well, and that doesn't involve getting your back operated on. I hope you're well, stay safe, and I'll speak to you soon.